Hello, everyone. Thank you so much for joining us for the second of CareerSTAT's four-part webinar series on employer best practices. Since we are on a short 30 minutes, I am going to go ahead and get started so that we can make the most of our time together. This is Melissa Cleater, the CareerSTAT Program Manager here at the National Fund. And today we're going to hear from Sharon Flowers on how Southeast Louisiana veterans healthcare systems investment in frontline worker benefits veterans both as employees and as patients. We will start with a brief overview of CareerSTAT, and then Sharon will give a high-level overview of some of their frontline worker investment programs. And then we'll do an interview with Sharon to learn a little bit more detail of the work that they do. And as we're in this 30-minute format and experimenting with it, I do encourage you to use the chat function throughout to ask your questions throughout the presentation. Next slide. So by way of background, CareerSTAT is an initiative of the National Fund for Workforce Solutions and is an employer-driven network based on peer exchange. The National CareerSTAT Network has members in 45 states and includes a range of healthcare employers across the continuum of care. The network also includes industry partnerships, workforce development partners, and philanthropic organizations. And of course, CareerSTAT is free to join and open to all who have interest in healthcare workforce development. The Frontline Healthcare Worker Champion program is a pillar of CareerSTAT and was created in 2014 by a group of healthcare industry leaders. And they really wanted to recognize and encourage their peers making sustained investments in the skills and career of frontline workers through recognition. And a peer committee sets the criteria and determines whether applicants meet the criteria for an emerging champion or champion status. Thus far, CareerSTAT has recognized over 50 healthcare organizations, which includes the new 2019 determinations. And I encourage you to stay tuned for a public announcement that will happen in early July announcing the new organizations. So the reason I talk about the Champion program is because the Champion organizations heavily informs the CareerSTAT Guide to Investing in Frontline Healthcare Workers, which offers healthcare organizations evidence-based best practices for implementing workforce investments and integrating them with business goals. This webinar series is really an opportunity to learn more about the best practices champion and emerging champion organizations used to invest in the front line. So now I'm going to turn it over to Sharon, who's going to share a little bit more about SLVHCS.
Thank you, Melissa. I am starting my video.
There you are.
Hi, everyone. So good afternoon. I'm going to tell you a little bit about Southeast Louisiana Veterans Healthcare System. We like to refer to it as SLVHCS. I know it's kind of a strange acronym, but you know, we're in government, so we love acronyms. So Southeast Louisiana Veterans Healthcare System, we provide quality healthcare to veteran patients throughout 23 parishes. And I know some of you refer to them as counties, but we refer to them as parishes here in Louisiana. Our services include community living center, primary care, mental health, telehealth, medicine, surgery, and other specialty care. We serve more than 70,000 veterans in this catchment area and across the Gulf Coast. And we anticipate 550 visits annually. Just so you get a sense of the landscape, we are sitting on 1.6 million square foot, and we just opened our replacement medical center. It's been about 2 years now. So we're excited to be in this state-of-the-art medical facility. Should I keep going, Melissa? Or?
Yep, please do. Run through.
All right, so just so you know a little bit about me, I am the Employee Education Officer or Education Chief here at Southeast Louisiana Veterans Healthcare System. Hopefully you guys are okay with me saying SLVHCS. I think that might reduce my time for probably 5 minutes and keep me with my 10-minute mark. But just so you know, I'm coming from an education standpoint. So we oversee all non-clinical education programs and training here at the facility for employees. So I'm going to talk about 2 entry-level programs as part of our learning objectives, and 3 facility-level programs that I'll describe very briefly and identify 6 best practices of a workforce development entry-level program. Next slide. So as I mentioned, I live in the world of employee education, and just so that you have some sense of what we do, we cover new employee orientation, activation orientation or campus orientation, any kind of professional development trainings, administrative internship opportunities for college students or high school students. And we also fund training or conferences for our staffs and oversee the leadership programs, which I'll be talking about. This side. Can you still see me pretty well?
Yeah.
Okay, awesome. Next slide. So when we look at our Hudson Thomas program and our EVAL, that's the Emerging VA Leaders Program, we are looking at entry-level employees. In federal government land, we refer to them as GS 1 through 6 in terms of, we refer to our grade levels as GS levels. Starts at 1, it goes as high as 15, and then there's another grouping. But we'll be focusing on our GS 1 through 6 and our GS 5 through 8 employees based on the leadership programs that I'll be highlighting. So this program, the EVAL program, Emerging VA Leaders, was started in 2017. As you see, we hold this program every year. In fact, it's going on now. Starts in January and concludes in June. So these are some of the facility programs that the participants of the program have designed and created and implemented, some of which we still carry on through today. And I'll be highlighting a few of these. The Hudson Thomas program, that's a GS 1 through 6 program, focus on reading, writing, computer skills, soft skills. They're assigned a mentor and a navigator. And that program was launched in 2014. Hudson Thomas was actually an employee here. He passed when he was the president of the union, and to honor his legacy of fighting really for entry-level workers to get promoted, we named the program, started and named the program after him. So when we look at our success rates, we see that 58% of the participants have been promoted since they completed the program. We've seen that 79% of participants saw an increase in their pre-post test scores, and this is the TABE testing for adult basic education tests. And that 92% of the Hudson Thomas program participants have still remained at the facility since graduating. So high retention rate. Okay. And that's just a few quotes that that are pulled out, basically highlighting the skill set that participants acquired and feel appreciative of, and the fact that we've also integrated some of the departments like HR to come in and talk about some real life skills that can help them get a job or qualify for a job. Focusing now, or redirecting our attention to the EVAL program, Emerging VA Leaders. Again, we're focused on the GS 5 through 8 employees, and this is more of a leadership enhancement program. So we focus on self-awareness, performance improvement, customer service, learning opportunities, managing conflict, and interpersonal skills. And as a group, we select up to 10 each year. As a group, they have to develop and implement a facility project that impacts veterans in a positive way. And the success rate for our EVAL participants, 79% have remained at the facility, so are still here after the graduation of the program. And 40% of participants have been promoted since completing the program. As I mentioned, I would focus on a couple of the facility level programs that were developed by the EVAL cohort. One is Reach One, Keep One, and it's basically an outreach project that's designed to increase the awareness of services that are provided for rural veterans through SLVHCS via our community-based outpatient clinics. We refer to that as CBOCs. And we basically go out to fairs, local fairs and festivals, and educate them that we are here and that there are clinics out in their areas that they can receive clinical services. And we see that there's been a 30% increase of those who were unenrolled are now enrolled in the system. So this is a program certainly that has helped increase the awareness and enrollment numbers of veterans who they have otherwise not chosen to come here for care. The Vet-TRAN program is basically a bus service, but I like to think of it as more than a bus service because it transports more than just our patients from, let's say, from one clinic to another clinic, but it also transports supplies and critical equipment to all of our CBOCs, community-based outpatient clinics, to the main center. So for some who may live in Slidell but need to come to the New Orleans Medical Center for care, there's transportation services that's provided for them. And this idea was developed by the 2007 EVAL cohort. And this is the number of riders that we've had since the inception of the program, almost 70,000. And that's just a map of Southeast Louisiana where we serve. And lastly, the 2013 EVAL group developed a customer service training called Service That Always Renders Satisfaction, so the STARS program. And 295 of Frontline employees were trained in this face-to-face customer service training. A few keynotes that we've heard from participants is they felt like their promotion was tied to the program and that the program helped them develop that skill set that got them the job. And also, they just have learned a tremendous amount of information from the program. And now we're beginning to capture, we weren't doing pre and post tests for this program, but we're now beginning to capture that for this program as well. So as I mentioned in the beginning of the slide set that I would go over some best practices. One would be to include selection criteria to ensure participants agree with the terms and gain supervisor support. For the Hudson Thomas program, it's a major commitment. It's twice a week, but I would say it's a major commitment. Twice a week, 4 hours each session. And then there's homework, and then they still have to meet with their mentors. So you certainly want to have the supervisor support because, of course, when they're in class, that means they're not on the job. Also to be transparent about expectations, what the program is, what it's not, and the commitment level that's going to be required in working with their mentors and their homework. Thirdly, to conduct pre-post tests, just to ensure that the program is being successful and that they are learning. There's a steep learning curve with the TABE test in this particular case, but also with the information as it relates to applying for jobs, because as many of you know, applying for jobs within the government is a skill set in and of itself. And there's a method to the madness. So certainly having a great understanding of how to write your resume and how to apply for the jobs, where to apply for the jobs is critical. Ensuring that, going through, I'm not on number 4. Ensure that they have the skill set, or I mentioned that, you were right, but I'm on number 5. And some education. We have a lot of education programs and trainings that are available at no cost for all of our employees. So just ensuring that they have pretty much a leg up on all of the services that are available to them. And ensuring that there's a partnership between the staff, instructor, the navigator, because we worked with a local community college to provide the instructor and to provide the navigator. So we have to make sure we're all on the same page. And of course, critical to any successful program is having leadership buy into the program. And we have full support from the medical center director on down. It just speaks volumes that he has allocated funds for the continuance of the program indefinitely, and the staff for the program indefinitely. So we're so grateful to have that level of commitment to both of the programs. The next slide. Any questions?
Yeah, so great. Thank you so much for that overview. And now I'll start with just a few interview questions, but I certainly encourage people who have questions to use the chat function to send those through and we'll work it in. But I know that a big part of why you are all so committed to investing in your frontline workers is because you are really dedicated to providing quality care for veterans. And I'm interested to hear a little bit more about how this commitment to invest in frontline workers impacts veteran health outcomes. And that's both for workers and for patients.
Okay, great question. I would say for the workers, we've completed 4 cohorts and we're working on a 5th cohort for the fall. And I would say over time, we've become more cognizant of the whole being, so to speak. We started out the program focusing on academic skills, because in our minds, and we did do an assessment just to see what the interest levels were and what kind of information and skill set the employees at these GS levels were looking for to get promoted. And over time, we've learned that it's not just the academics that is important. I don't think it's even just for this cohort, but particularly to this cohort, since we were focused on them, that as each cohort completed and we assessed and evaluated how things went, we learned that not everybody wants to go back to school. So just focusing on the TABE test wasn't enough. We needed to also begin to incorporate speakers from the facility that included, for example, PR, helping them with public speaking, including HR to help them with their resumes, including education to help them understand what other programs, what's their next steps as it relates to professional growth. So we just learn from cohort to cohort. So it's now become this whole health, and we're talking about cohort 5, ensuring that we have a mental health professional that comes in and speak to them. We have a nutrition professional that comes and speak to them. I mean, we're on a medical center campus, so it only makes sense to look at the whole being as well. And as it relates to patients, if you're upskilling frontline workers, that's certainly going to improve the quality of care that veterans should receive and are expected to receive when they come here for care. And not to mention, if you have employees that feel accomplished and feel like they have room for growth, they're engaged, a happier employee certainly lends itself to a happier patient and someone who wants to be here. And there's so many data points and research that just shows that quality of care goes up when the employee is happier and engaged.
Great. So are there any barriers or challenges that are unique to veteran frontline workers?
I would say that veterans face many of the same common barriers to employment that other frontline workers, which include like housing, transportation, childcare, education, and skill set. So we try our best between the navigator, the mentor, of course, the supervisor, to address some of those issues and where we can influence some of those issues to make the program more palatable for them.
Okay. And what advice would you have for colleagues who are interested in recruiting veterans?
I would say that it is critical because a lot of the veterans a lot of the veterans I work with are retired military. And even if they're not, when they get out of the military, generally they've been in the military for an extended period of time. So it would be great to have someone that helps them translate those skill sets into civilian life, so to speak, and the positions, targeting a specific position and helping them write the resume so that they can qualify for the job. So oftentimes I see that many of the veterans have training experience in their background. That may have been interwoven in everything they've done, but that wasn't their title. They weren't a training instructor. So having someone that will help them pull out that skill set that was in their career track, but they may not see it as a valuable skill set because it was ancillary to their title, their job title, for example. Also, I would say make sure mental health services are available. There's statistics that show too that it's higher in the veteran population, so that may be an added bonus to have that on site. And we do have the Employee Assistance Program Coordinator here available to everyone, but as soon as we identify a problem, there is someone there that our staff can go to.
Great. And then we have a question from the audience. Could you describe the difference between the navigator and the mentor roles?
Yeah, great question. So the navigator is formally, has a schedule to meet with each of the participants for an hour every 2 weeks, just to check in. How are things going in the class? Do you feel like you're falling behind? And they're documenting, there are a set of questions that they ask each of the participants. So it's more of a formal relationship with a set of questions that we want to make sure that attendance, there's nothing impacting their attendance or nothing impacting them getting value out of the program. Whereas the mentor relationship is more of an informal relationship, and I don't want to say dictate, but we don't tell them what exactly should be happening in each session. They're just a support for them, and we just ask them to help them with navigating their career choices. So it's a less formal relationship, and it's more about career growth from the mentor standpoint.
Okay, great. So I think we have time maybe for just one more question. And I'm curious, you know, I know that the VA system is a part of the federal government, and I'm curious as to whether being a part of that system impacts your workforce development programs.
Absolutely. It certainly does impact in a positive way because there are many programs at the national level that funding is a part of the program. So resources pretty much trickle down. We don't have to create very much from scratch, so to speak. And we have a community of 152 of the other medical centers, not to mention a wealth of other employees who work at these medical centers that we can send an email to and say, how did you handle this challenge? Is there anyone out there who has a program similar to this and don't have the budget, or what have you done to overcome certain obstacles? So I think it's a built-in community, so to speak, that we have at our fingertips. And it's just a great way to stay connected with the country and learn from other people's mistakes, I would say, not reinvent the wheel.
Okay, great. Well, thank you so much for joining us today and sharing a little bit more about your work. I just have a few closing things in our last 5 minutes that I want to touch on. First is that our next webinar in the series is scheduled for May 21st, and we're going to hear from Emerging Champion Tufts Medical Center and how they leveraged its participation in the Boston Healthcare Consortium, which is an industry partnership, to strengthen their community partnerships and to deepen its commitment to the investment in skills and careers of frontline workers. And I think we had a link, but we may be having some technical difficulties with that link to register, but don't you worry, there will be plenty of emails that will come out for you to be able to register in advance for that webinar. Then I also just wanted to give a shout out for the National Fund convening. The time is now. That will take place June 25th through 27th in Dallas, Texas. And there is a link in the chat box to find out a little bit more information about that and see if that's something that would be of interest to you. I can say that June 26th is dedicated to employers. While folks are welcome to come to the entire conference, that might be what's most pertinent to you if you have limited time and availability. And then finally, I have also sent out a link to an evaluation for this webinar. So if you could please just take a few minutes to share your thoughts and provide us some feedback, I would really appreciate it. It's just a handful of questions. And you know, the work and the information that you provide really does inform the work that we do here at the National Fund. So I really appreciate it. And with that, I again want to thank Sharon for spending some time with us, and all of you taking time out of your busy days to hear about the best practices of employers. And I hope that you will join us for the next one in May.
Awesome. Thanks so much, Melissa. I appreciate the opportunity.
Absolutely. Thank you so very much.
You're welcome.
Bye, everyone. Have a great afternoon.
Bye-bye.